The common goal of Philips and Salesforce is to demonstrate the ability to manage care, to manage health in a much better way, connected with constant analytics of data across the entire healthcare ecosystem. We have teamed up because jointly we will be able to address the major challenges in healthcare. We think that in the future, patient relationship management in real time will be at the center of delivering healthcare. And that is going to be supported by our joint envisioned platform.
You see all these great technologies, and I think as an IT guy, I can tell you, you can basically tie everything together. But the bigger question is, can you really make it scalable to millions and millions of patients? Can you make it secure so that your data privacy and security is ensured? And can you make it adaptable? Because we're starting just at engaging patients in new ways. But then you can ask yourself the more important questions. It's not just the technology, but how can we use the technology? And I think we gave ourselves a big challenge. We said, how can we make an 80-year-old person with multiple chronic diseases actually start using this technology? How can we have a nurse in a telehealth center actually managing hundreds of patients at the same time and in real time deal with issues? How can we actually have multiple people? How can we have a general practitioner, a health coach, a hospital, family? How can we all engage them in the care of these patients? And I think this is what we're talking about. And what we're going to talk about is two products, the eCare Companion and the eCare Coordinator. The eCare Companion is actually a simple device. It's a tablet. It's mobile technology, and it's carried by the person at home. And connected to the eCare Companion, you see a host of connected devices, and we'll talk about it, we'll show it to you. So what we're going to show to you is a person, Janet. And Janet is an 80-year-old person. She's actually 82. She has multiple chronic diseases, and it's very much like my own dad, who's 81, who has had cancer, who lives at home, also with multiple chronic diseases. So how can we engage Janet in her own health? Well, first, we engage with her through surveys, and these are highly personalized, very simple. Give us feedback on how you feel. And then going back, the more important thing is we really want to understand what her vital signs are. So we ask her to take measurements. We ask her to just stand on this weight scale, and this weight scale will immediately upload the weight in the cloud. We'll actually ask her to take her medicine, which is dispensed through the pill dispenser. And if she doesn't take the pill, we get an alert. So with that, let's go to Susan. Susan is in the telehealth center, and she's actually managing hundreds of patients. And clearly, she only gets the data on what is really, really relevant at this moment. We can have huge data from the EMR, but it's really about what is the data that's relevant at this moment when you're dealing with these patients. And we implement a smart algorithm that allows the patients with the highest acuity to come up first. And actually, we see Janet there. So why is Janet at the top? Because we have some concerns we have some flags that tell us something is not well with Janet. So let's drill down on what's going on with Janet. And first, you see, we just get all her detail, and we can pull in all the relevant data from her medical record. But we see there are some issues. So we look at the triage, and we see, hey, there are some issues with her blood oxygen, because she is a COPD patient. She has a lung disease, just like 330 million other people. 330 million people suffer from this. And it's lifestyle related, because most people have been smoking who have this disease. But we see a couple of issues. She has been prescribed medicine, antibiotics, but she hasn't taken her pills. And we see actually her blood oxygen going down, and we're really concerned. So what? Let's give her a call. So we're calling out to Susan here, look at the trends, and you can see that her blood oxygen, the blue line, has been going down steadily, and that's not good news. So let's call up Janet, and let's talk to her. So we're back to Janet, and we basically say, Janet, can you please, again, do your blood oxygen? So we connect her on this device, which is Wi-Fi connected. This will measure her blood oxygen, which we immediately push into the cloud. And we basically asked her, hey, Janet, we saw that you didn't take your medicine because the pill's still in the tray. So she's taking her medicine. So now we're back to Susan. And Susan says, you know what? I actually want to tell Deborah, who's on my care team, about this. And let's go to the snapshot. And there we are exposed to the social environment. I'm going to send Deborah a message actually talking about what's going on with Janet. And you know what? I also asked Janet's daughter, give her an update on this, because we've given her permission to get access to this social environment where we can all collaborate to make sure that there are no acute situations happening for Janet. So you see, what you see here is the combination of mobile technologies, connected devices. You see actually a very smart environment where we pull in the data that's relevant. We have social capability where we can collaborate around the care of Janet, including her family. And actually this is production level code. And what's interesting about our platform that we built together with Salesforce, we actually built a really complex clinical application, mobile application in 6 months. And we believe that's the power of the platform. It's the security of the data, the mobile capabilities, and lastly, our ability to have people truly and easily collaborate.